For the severely or moderately immunocompromised persons, SAGE recommended that they should be offered an additional dose of all of the WHO EUL COVID-19 vaccines that have been approved. And when I mean all of them, I mean the mRNA ones, the adeno-based ones, and the inactivated ones. We feel, as will be published, that there are a number of people who have a compromise in their immune system, and therefore they need a third dose as an additional priming process so that they're fully protected. In the case of the two inactivated vaccines produced by Sinovac and Sinopharm, all the evidence we have reviewed indicates that there is a need for an additional third dose of the homologous or the same vaccine. This should be started to be offered to people age 60 and above, since they are the ones that have shown the biggest problem in response. And this has to be an extended primary series. The use of another vaccine, not the same Sinovac or Sinopharm, as an additional dose may also be considered if there is enough supply and access considerations. The strategy prioritizes vaccination of high-risk population of all adults and fully commits to the risk mitigation approach by calling for a 70% of the world population to be fully immunized by mid-2022. This is a much larger proportion than we thought before, but given the way the pandemic is going and given the availability of new vaccines for younger age groups, we feel that this is an attainable goal.
That's a distinct thing from giving additional doses, booster doses, to people who have had an adequate primary response to vaccination, and the argument that that primary response might decline over time and therefore needs to be boosted to get up to back where it was or even beyond where it was. At this time, and as the Director General has called for, a moratorium on booster doses for the general population, because giving those booster doses to individuals who already have had the benefit of a primary response is, as has been explained before, like putting 2 life jackets on somebody and leaving other people without any life jacket. The worldwide supply is now at a point of about 1.5 billion doses per month. And our targets for 40% vaccination, full vaccination of all populations in every country by the end of this year, there's enough supply to do that. There was certainly enough supply to get to the 10% target by the end of September in every country. If the vaccines had been equitably deployed, we in fact would have gotten there many months ago.